Hello, everyone. It's Emily here with Senior Helpers. And today we're joined by Kate with Ability Home Health Care. And Kate today is going to talk to us about Alzheimer's and just a bit of information about Alzheimer's and how we can see the warning signs and stuff like that. So please take it away, Kate. Thank you.
Hello, everybody. Thank you so much, Emily, for including me in your Wellness Week. Again, I really appreciate you including me and giving me the opportunity to share. Today, I'm going to talk a little bit about Alzheimer's. And I mean, I don't know if you guys were on yesterday on Emily's show here, but she actually included Angel Hoffman, who's our executive director of the Alzheimer's Association in Northern Colorado, and she's wonderful. And I am not going to go into a lot of the signs and symptoms and warning signs and things like that because Angel did a beautiful job of that yesterday. So go on and check that out if you're looking for more specifics about what to expect and kind of what to look for. And I'll be referencing that a little bit. So feel free to go back a day, I guess is what I'm saying. So a little bit about me. I'm with Ability Home Health Care. We provide medical support to people in our community, and I have been helping people in our community in the healthcare world, senior care world, for about 10 years now. And I've worked with thousands of families who have either been caring for somebody with Alzheimer's, had Alzheimer's or dementia themselves. Again, that definition of Alzheimer's versus dementia, they are two separate things. Well, Alzheimer's is a form of dementia. There's hundreds of forms of dementia. Angel talked about that yesterday, so head on over and check that out. But what I've found over the 10 years in working with these families who are impacted by Alzheimer's is that it's different for every single person. And so there's not a copy paste plan in place for every single family or person who is impacted by any form of Alzheimer's or dementia. And so it's really important to understand that first and foremost. And so it's really about kind of overcoming obstacles as they come up. And there's a ton of resources in our community to support people depending on where they're at in their stage with this disease. And it's not curable at this point. There's no special pill that you can take for Alzheimer's or dementia. So it's important then to understand what can happen and then what resources are available. So I strongly encourage you to figure out what those are in your community. We are lucky in Northern Colorado because we have resources like the Alzheimer's Association. We have Dementia Together, which was formerly Dementia Friendly Communities. They work tirelessly to help families and people with dementia and Alzheimer's and have resource groups. It's so important for people who are caring for people with Alzheimer's or dementia to take care of themselves as well, because it can be a tough journey. And thank goodness for the Alzheimer's Association and Dementia Together in our specific community. But there's a lot of other resources too. But they're a good place to start if you know somebody who hasn't been connected with them, because they can not only connect you with other people to talk to, but also connect you with the appropriate resources depending on what you're needing. I'm going to highlight just a few resources that I've seen families utilize and how those different resources have helped. One of them is the Advanced Care Planning Team with the Health District of Northern Colorado. So as soon as somebody is starting to display those common signs and symptoms of dementia or Alzheimer's, it's early diagnosis is so important. And people are like, well, why? They're going to progress anyway. Well, because you can still capture really the essence of what that person wants as their disease progresses, and it is guaranteed to progress. So it's important to catch it early on and have conversations like, what do you want at the end of your life? Would you want to be in a facility? If you get to a point of being in a facility, what does that look like for you? And it's just really important to have those conversations with your loved ones before the capacity is not there and they aren't able to capture that for you. So early planning and early detection is important, and it's also important to get your advanced care plans in place, and that's free at the health district, so you can get those done, anybody over 18. Just ask for Mindy Rickard, she'll help. There's also, most people are trying to stay in their homes, but that's not always possible, especially with something like Alzheimer's or dementia as it progresses, because care can be a little bit overwhelming for families. Bringing in care long-term support isn't always feasible financially, even though I know people try as hard as they can to stay there as long as possible. So non-medical home care is incredible. They have caregivers who can relieve family members so that they can leave for the day and go out and get their groceries done, or go get them for them. So non-medical services are a huge player in taking care of people with Alzheimer's and dementia. It's important to know who the different agencies are that provide that support. Obviously, Senior Helpers is one. Medical home health care, which is what we do, we are usually getting involved with people who've had falls or accidents as a result of their dementia or Alzheimer's. We also do a lot of speech therapy with people with Alzheimer's or dementia, early diagnoses, potentially giving them different exercises and things that their loved ones can do with them or that they can do on their own to potentially extend their cognitive functioning. And there's a lot with when people do potentially transition to a senior living community, especially if they're late in the game with Alzheimer's and dementia. It can be really hard for them to figure out how to navigate a new community, and our therapists specialize in that transition as well. So that's kind of medical and what their role is. There's different types of senior living communities. There's independent livings, assisted livings, memory care, skilled nursing, just senior apartments. And so it's really important to understand all those levels of care, regardless if you're dealing with a dementia or Alzheimer's diagnosis, because the likelihood of you needing some extra support later in life is pretty significant. 2 out of 3 people are diagnosed with Alzheimer's and dementia. So that's a lot of people, or 1 in 3, excuse me, 1 in 3. That's still significant amount of people who are diagnosed with dementia and Alzheimer's, and it's just more and more every year. So really, no solution's the same. Nobody's situation's the same. It's like saying, hey, what was your birthing experience like? Well, it's completely different for every single individual. And so Alzheimer's and dementia journey can be like that, which is why getting involved in support groups with the Alzheimer's Association or with Dementia Together can be such a huge benefit to not only the person with dementia or Alzheimer's, but their caregivers. Because then you're neck and neck and shoulder to shoulder with people who are walking through that same journey and who maybe have stumbled across the block that you just stumbled on. It's a hard journey. It's a tough journey. We're lucky in Northern Colorado, though, to have a lot of amazing resources available. So I guess I would just encourage you, if you're early on in the journey, to get connected with the different resources that are available. If you need information on any of these resources, you can reach out to Emily at Senior Helpers, or you can reach out to me anytime, and we're happy to connect you. Thank you so much for taking a few minutes to learn about the different resources. I hope it was a little bit helpful.
Thank you so much, Kate, for joining us, and thanks everyone for joining us and watching this video. As Kate said, you can go watch Angel's video and she'll tell you about all those warning signs, but if you already know those warning signs, please do get tested, because you can only get the resources and you can only join those support groups if you already know that you have the disease or someone that you love has the disease. So thanks again for joining us, and thank you, Kate. Bye-bye.
Bye.